One. A hearty good afternoon to everyone, and welcome to a session on vomiting in pregnancy. We are glad to have Dr. Anshul Rana among us today to help us explore the topic. Through the process of pregnancy, morning sickness is something common and routine, but some pregnant women experience very bad nausea or vomiting. This is called hyperemesia. Now, this
Hyperemesis.
sickness can hyperemesia. Thank you. uh, this sickness can it's difficult for most people to experience, and it is not something good on the long run as well, because it is something in which the pregnant woman is not able to consume a normal diet. So we are glad to have the doctor over here with us to educate us on this topic and to help us understand more about it. And if you have any doubts relating to it, let us know in the comment section down below. So doctor, you have the stage.
Thank you for kind introduction. I myself, Dr. Anshu Rana, as a senior consultant at Apollo Credit Hospital, Greater Noida. So today I'm going to tell you about a very commonly faced problem by a pregnant woman, that is vomiting in pregnancy. So I will tell you the what are the basics and by which you are going to just come up with the problem, and for what is the reason, what are the basic fault by which these problem can be exaggerated and can be worsened, and by taking small care how can you prevent these problems. So basically, vomiting during pregnancy is one of the commonest thing we all know, because you all must be knowing that in previously we used to see a Hindi movie, and the first thing they used to show up, and as a pregnancy they used to see tell like to vomiting. If the somebody is vomiting, that means it indicates the pregnancy is there. So by that much it is popular. So yes, it's very common thing during pregnancy, and usually in first trimester of pregnancy, 50% of a woman used to go through that. But definitely, there is a some limit by which we can say कि this vomiting is normal, and this is not this is not normal, and you have to come to hospital and to meet your gynec. That is the concern thing. So today's lecture is basically for the thing when you have to contact your doctor. Sometimes patient feels like yes, the vomiting is very common and that's why I'm having, and she keeps on just bearing the things, and sometimes it used to get so worsened, so they need a medical attention, and they need a care by on a IPD basis, that means after admissions. So purpose of taking this lecture is to know when to you have to when should be you should be alarmed. Yes, this is the time when I have to tell my doctor and I have to visit a doctor. We should not ignore it as if it's happening to the everyone. That's why it's happening. So before going into details, first of all, I just wanted to tell you vomiting is in pregnancy is a common. What is the reason behind this vomiting? So basically, serum human chorionic gonadotropin hormone, which is happening in early gestation period formation, it's happening in a body, and that is one of a responsible factor of the vomiting, which this hormone is a basically pregnancy hormone which starts the moment the pregnancy happens, the moment the fertilization happens, this hormone formation happen, and this is the one hormone which we used to by through which we used to check by doing a pregnancy test kit. And in that, if the pregnancy is there and hormone is there, that kit used to pick up, and by through that we are able to know yes, this lady is pregnant. And this one hormone is a culprit for the pregnancy, because this hormone basically trigger your vomiting center which is inside your brain, and it all depends if what is the level, and accordingly and how in particular individual how it will affect. So according to that the pregnancy vomiting happen. As I said earlier, the 50% women go through this pregnancy in vomiting during pregnancy. And if it's not affecting your day-to-day activity, it's not affecting your health, like you're not, like suppose you are able to perform your day-to-day activity, you are able to eat your food, still sometimes you feel pukish, and sometimes in a day or 2 day period, sometimes you vomit, that is normal. In that, that is acceptable. But if the somebody is not able to take food, even a liquid thing or anything from a mouth, and she is just not able to perform her day to day life activity, that means really needs a help of doctor, and you need a medication for that. So as I said, that is the one culprit. HCG is a one of a culprit for a vomiting during pregnancy. Apart from that, other hormones also responsible, which is happening, and their level used to increase during pregnancy. These hormones are the estrogen, progesterone. So these hormones level used to increase to sustain your pregnancy, to maintain your pregnancy. And as these hormone level, as your pregnancy advances, these hormones level used to get in a higher level in your body, and that triggers your vomiting point, and that ultimately causing a problem as like a vomiting. Then you will be afraid, if it will be happen like that, the more the advanced the pregnancy will be, the more I will be in trouble. No, it's not like that. So initial days of pregnancy, in first 3 months up to usually 16 to 18 weeks, this hormones trigger used to be more, and that starts from very for 6 weeks early pregnancy, and it can go up to 16 to 18 weeks usually, and that is considered as a normal vomiting during pregnancy if it's not that hampering your day to day activity. So usually vomiting starts from 6 weeks of period of gestation, that is 1.5 month period of gestation. As pregnancy goes, it used to get little worsen at the peak. Usually from 9 to 10 week, patient feels more of pukish, more of vomiting sensation, and it can go up to 16 to 18 weeks. As the pregnancy advances, these things used to get settled, and gradually patients started feeling better. But in some situations, this hormones level used to be very, very high, and because of that reason, patient feels or patient suffers a lot of vomiting, which is not normal. So you should aware about, if anytime you are having too much of vomiting, even after your things are going well, but still you feel ki every day you are vomited twice or thrice, and it's too much. That means that is an alarming thing. You have to report to your doctor, because there is other situations also where the vomiting can happen too much while during pregnancy. That is not a normal thing. So what are the situations? So first of all, in like suppose your vomiting frequency is very high, there is a chances of you are not conceived with a singleton pregnancy, you might conceive with a multiple pregnancy. That means you might get pregnant with a twins or triplets. So in that, obviously the levels of the hormones will be more, and the chances of vomiting will be more. Apart from that, not only the healthy pregnancy, there is a one pathological condition of pregnancy known as a molar pregnancy. In that particular situation, pregnancy is not happening healthy, and there's some pathology started growing because of that hormone, and that hormone that because of that pathology, the your hormonal system will be more triggered, and that more secretions of hormone, which causes more vomiting. So that's why anytime you get pregnant, the pregnancy should be confirmed by the ultrasound. So you have to report your doctor, you have to meet your doctor, even if everything is going well. We have to confirm either it is a pregnancy is a healthy pregnancy or not, or it's growing well or not. So these things are very, very important. Now coming to the what kind of if I will go for the vomiting itself. So there's a basically we are just dividing this vomiting as a two part. Like one is a simple vomiting, which is happening, as I said, in 50% of patient. Most of the patient get recovered by 16 to 18, 12 to 14 weeks, and at last by 16 to 18 weeks. And if it's not hampering your day-to-day activity, it's you're able to take your meal, you are gaining weight, and everything is going well, then it's fine. The only the few medication and the few precautions can be helpful for you, and you can go ahead for the further pregnancy very smoothly. But if your journey start with a too much of vomiting, so how you will define what is too much for you? So basically, if any time you feel you are not able to take anything from your mouth, or you are able to throw whatever you are taking, or even you feel weak or dizziness, or there is a sign raised of body temperature, foul smell from your mouth because of the repeated vomiting, and the coated tongue, dry skin, you feel irritated. So these are the signs when you have to reach hospital on an emergency basis. So this is called a hyperemesis gravidarum, means excessive of vomiting during pregnancy is termed as a hyperemesis gravidarum. This basically requires a hospital admission and to be treated as a on a injectable medicine with the IV fluid. So it should be treated as early as possible, because the more it will be neglected, the chances of the other organ involvement is more, and it can go up to extent of the so going on a maternal complications in so many forms like esophageal rupture. Then there's so many things which can happen, the wrong thing that can cause an acute emergency. That's why it should be taken care as early as possible. Apart from that, whenever you feel a too much of vomiting, apart from the pregnancy related vomiting, it should be again very carefully diagnosed with, is it the any other cause of vomiting is also there, is it why it's happening, is it only related with a pregnancy, or because some other problems which can be presented like seeing as like a too much of vomiting during pregnancy and we can miss it. So the person should visit a hospital, they should be investigated, and the other reasons of vomiting like peptic ulcer disease, like gallstones, like simple gastroenteritis problem should be ruled out before going ahead for any other treatment. Now coming to the treatment part. Suppose if the person is facing like a simple vomiting, as I said, which is happening in a 50% of patient, that to be taken care by just taking few precautions in manner of your diet, and it's sometimes required. We used to give a few medications which is very safe during pregnancy. So that medication will help you for your normal healthy lifestyle. So it will just not hamper, because nowadays most of the girls are working women, and if she will be with a feeling of whole the day nausea and vomiting, definitely she will not able to perform her professional life very nicely. So usually nowadays we used to give a medicine, to keep a patient on a medication which are very safe, she can take for a longer time, and which you don't need to avoid, because sometimes it patient used to say, should I take this medicine, or we should avoid, because most of the time girls used to be little afraid by taking medicine, just try to just avoid it. But I just wanted to tell you everyone, it's quite safe. Whatever the medicine we are giving during first trimester for the pregnancy induced vomiting, that is quite safe, and you can continue with that medication. There is no harm in taking that medicine. Apart from that, few small tips related with a diet which is very helpful during pregnancy to just avoid this excessive vomiting. So these diet tips are, you should start your day with the carbs. Like carbs, most of the time, as an Indian scenario, we used to start our day with the liquids like lemon water or tea or coffee, something like that. Or somebody used to take a lukewarm water, just start your day. So these should be ideally not done while during your first trimester. You have to start your day with the carbs containing thing. Banana is a very good thing which you can start your day, because it contains lot of carbs, as well as it's a very smooth, which is very good for, and it will just prevent your hyperacidity state, which is very common during pregnancy. Apart from that, you can start your day with a dry toast, dry containing thing, anything which is just binding thing, which is not harmful, which doesn't trigger your vomiting point, that used to be a good for you. So you start your day with the solid light food like in manner of toast, and fruit you can choose a banana. Avoid to take citrus fruit in the start your day with the citrus fruit, because that causes more acidity, and the more acidity will ultimately causes a problem, and it will you will vomit more. So this is one of a vicious cycle which is happening during pregnancy. Because of the hormones, as I said, that hormone itself causes a sensation of a vomiting, and that problem causes your not feel like eating anything. So because of that reason, you starve yourself. So ultimately, there is more of the acid release, and you will get more acidity, and you vomit. And this cycle used to happen like that again you vomit, you don't feel like eating. So this is a one of a vicious cycle. So somewhere we have to stop and break this cycle. For that, best thing is to try to take a small frequent meals, whatever you feel like, you just eat, keeps on eating, even you are throwing pukish feeling or you are throwing your thing frequently, but you are able to take in, you should, because that is the only thing which will be helpful, because the more you will starve, the more you will be acidic and the more you will vomit. So first you have to just understand that. So if anybody is having vomiting, you should not stop eating, you should take up diet and you should take a small meals, and small frequent will be very small frequent meal will be very helpful to prevent your pukish feeling. So one first basic thing which you have to know. Apart from that, so it's not necessary to take a start your day with a healthy diet. The moment you used to get pregnant, your all that elderly mother, elderly person at your home, they used to suggest you try to take a nutritious diet, try to start your day with the almonds, milk, something like that. It's not necessary. As I said earlier also, you have to avoid your liquid intake. Start your day with the liquid intake to just prevent your vomiting center. So that is the one thing you have to keep in your mind. Whatever food, healthy food option is there, that you can take in a later part of your day, but start your day with a dry, healthy carbs containing food or fruit like a banana. So this is the one thing. And you have to follow your small frequent meal. Even after that, if you are feeling you are throwing again and again, your vomiting frequency is high, definitely you need a further care, and you have to visit your doctor. They might be increase your that you might require a anti-emetic, that is anti-vomiting drug for you, and other medicine which is required for you. So this is the basic thing which is required. Now coming to the hyperemesis. What is hyperemesis? I told you earlier, the excessive vomiting which is hampering your day-to-day activity, or you are not able to maintain your daily routine, or apart from that you are feeling weak, you are losing weight, you are dry coated tongue, you are having signs, you are having feverish kind of feeling throughout a day, foul smell from a breath. So these are the signs when you have to visit a doctor. You might need an admission and you should be get admitted. And in this, we used to start a treatment with the injectable medicine as well as the IV fluid to correction of the electrolytes and other changes which is happening, which is a major changes one happening because of the too much of vomiting. There is a one ketone formation happen, and that you might be ketoacidic. So that needs a really to clean up. So the your doctor will send the few set of investigation, then your treatment will be started in form of anti-emetic drug, anti vomiting drug, anti acidic acid, that antacid will be started, IV fluid will be still. So finally the our aim is to maintain your electrolyte, and we used to keep a patient for a nil orally for 24 to 48 hours till the time her other internal system will be not normalized and she is not able to accept orally. So these are the treatment which usually required, and at later extent sometimes patient needs a lot of medicine to control the things. But definitely these things which is preventable, that you have to prevent, you have to take precautions and you should prevent all these treatments. Apart from that, now if the somebody is facing, like somebody is a twins pregnant and she is going through all these problems, so sometimes you might face these problems even after 16-18 weeks, which is normal duration is usually that vomiting during pregnancy used to subsided by 16 to 18 weeks. But sometimes few patients even face in later part of pregnancy, which is not very common, but it might happen. But you should not be worried about this. You have to just go for whatever the treatment your doctor had given. And I'm repeatedly saying, whatever the medicine which we are giving for during pregnancy, for the vomiting during pregnancy, that is absolutely safe, because sometimes most of the time patient is not taking medicine just in fear of कि maybe because of this medicine my child will be affected. So that is to be not done. That you have to, you can take a medicine, because in an early period of gestation, whatever the medicine which we are giving, that used to be very safe, and that is in fact helpful in your nutrition part of your pregnancy. So you can take or you can continue these medicine for a longer time till your doctor will suggest you, and just avoid all the complications which can happen just but by not taking medicine. So these are about the hyperemesis and gravidarum. If sometimes like you feel the your even if the taking all the medicine and everything, your the vomiting part is not subsided, you are again still and intermittently like for a few weeks you are okay, and that you again you are going through, then definitely you have to look after of your diet pattern, because the diet pattern is again very very important. There is a role of dietitian in during pregnancy. You have to visit your that gynec or definitely to the dietitian also, because the dietitian will help you what is the frequency of your diet and what is the kind of food you have to take. That is very very important during pregnancy, because simultaneously we have to take care of your vomiting part as well as your nutritional part. So you should be aware what to avoid and what to take and how frequently you should, because sometimes people used to force herself, even if she don't feel like eating, she used to just feed herself to just take care of your baby nutrition and all. But it's not necessary how and how much you have to take, that you have to better take a opinion from your dietitian, and she will help you in that way ki what and how much you have to take and what is important at what. Like just for a basic guide, I just wanted to tell, like if usually patients started taking protein in very first 3 months. Let me tell you, protein is not a thing which should be taken from very first day, because protein is definitely required during pregnancy but not immediately after conception. It will be required once your baby will be started growing, gaining a weight. That is usually the protein used to protein requirements start from second trimester onward, like after 16 weeks 18 weeks you need a protein. Before that, if you will take a protein, you will be more prone for acidic. The emptying time of the your stomach will be less, and chances of having more acidity, more vomiting, and ultimately you will land up with a loss of weight and too much of vomiting. So these are the small precautions, small dietary precaution you can take to avoid your vomiting during pregnancy. So that much. And then apart from that, I just wanted to tell you, if anytime you feel too much vomiting, you have to report your doctor, you have to follow the medicine. You should not leave your medicine in between before without consulting your doctor, because few medicine which is really really required for all the patients. And sometimes patient herself used to start with the protein, as I said, protein, iron and calcium the moment they used to get pregnant. That should not be done. There is a time of everything, which at what period of gestation what to start. So initial 3 months the only the folic acid is required. Apart from that, sometimes we used to give a medicine for the acidity or something if required in that particular patient. But it's not like if your pregnancy start you have to start supplementing yourself on your own by the iron, calcium in manner of protein. That all requirement is definitely there, but it needs a medical help at what period of gestation and how it has to be started. So this is all about your vomiting during pregnancy. So if any question or any queries you wanted, please you can ask. So I can see on my screen no question yet. So hope everybody's just whatever I've said is understood. What I just wanted to just message through a message through my this talk, what is exactly to be done to take care the small myths and bits about a pregnancy. Thank you so much.